Hello there and welcome. My name is Julie Hirschberg, if we haven't met, and I'm a neurologic physical therapist, the owner and founder of Re+active Therapy and Wellness in the Los Angeles area, and joining you live today, this month, actually, all month long to talk about functional neurologic disorders. And so many of you have sent me so many great questions that I just love. So we're going to hit on one of the questions that was asked just recently was, can you share some of the best, I'm misquoting the question, but the best treatment techniques for dystonia, functional tremor, and things like that. And by the way, I will share lots of treatment pieces, but I always have to go back to assessment before jumping into treatment. And this is so important because treatment's not a one-size-fits-all. We have to match the treatment to the person. So this is the perfect question, though, and I'm going to talk about the assessment in these different types and what we might see and how that leads us to treatment. So, of course, I have to share our assessment pie chart. So last week, I shared the pathophysiology pie, which really brought in the neuroscience, the background of the research. I'm struggling getting my words out today. The research that is behind the understanding of a mechanism of functional neurologic disorders. And this, by the way, particularly talks about functional movement disorders because the person asked specifically for that. So dystonia, tremor, weakness, and things. But a lot of these things you can apply to functional neurologic disorders as a whole. And last week I talked about the pathophysiology and evidence in each of these areas: motor control, sensory, psychosocial, lifestyle, autonomic, and physical limitations. So today I want to talk about the assessment pie and how we, as physical therapists, occupational therapists, speech therapists, even psychologists, look at the underlying pieces that might be contributing to somebody's symptoms. And when they have a movement disorder, such as tremor or dystonia, so excessive movement in those cases, we want to look at all of these pieces of the pie. Now, motor control, I think, is the most obvious because the person's having trouble with movement. So when we assess motor control, we're looking at things like implementing the optimal theory. How does that person respond when we add an external focus to movement? We see often that the movement will change, and that is great and unlocks some automatic movement, and it heads right into treatment. So when this therapist asked this great question, I would say external focus, assessing that to see if that changes the movement capabilities, and then using it in treatment. Some of the other things that we might look at are also just an overall movement analysis. What is the pattern of movement that is appearing for that person, and does it change? So often with functional tremor, for example, we'll see a change or variability in the movement pattern, and we'll want to see, does it change with rhythm of the other limb, for example? Does it change with music or a metronome? Also an external focus, by the way. And then again, we would take that right into treatment for a person. We've been sharing a lot. Actually, we have some really great videos of mirror therapy. And this is actually kind of an overlap between motor control and sensory, because there's a sensory perceptual piece of mirror therapy too. But what are the response to doing that movement in the mirror? And then boom, that becomes treatment. This is why assessment is so important. We've been talking about sensory treatment as well. I shared one of my favorite sensory actually assessments and treatments is using the dominoes and identifying how many little dips in little dots in the dominoes there are with the hand. And this is a great way to assess sensory discrimination, but also bring it right into treatment. We use this for any kind of functional movement disorder, dystonia, CRPS. So that would be an example of sensory. Here's what is so important, because people go, oh, well, when would I use that sensory treatment? If somebody has a sensory discrimination problem, so you have to assess it too. So doing things like 2-point discrimination, tactile localization, kinesthesia, joint position error, and so on. We love using the laser for joint position error testing. And I know it's validated for cervical, but we actually will put the laser on any body part and use that for joint position error testing. We also will look at, as part of the sensory system, the vestibular system. This is so important in any kind of functional neurologic disorder, especially 3PD, but in movement disorders as well, and dystonia being a big one. So we'll assess the vestibular system, we'll assess their visual sensitivity and dependency, as well as part of the sensory system. And then, again, that goes right into treatment. So we talked motor control, sensory, psychosocial. We'll screen for this. I'm not a psychologist. Certainly our psychologists will do more in-depth testing and understanding for a person, but we'll screen using some self-reported measures. The HADS, the PCS are really helpful ones. We may look at another one. I'm not sure it's actually on here. No, the SHUT-D. I love this one for measuring disassociation as well. So that's one way we may screen and work. This is why we work as a team. I mean, you can see the pie chart. There's a lot of pieces of it, and I think it really takes an integrated team to address all of these pieces together in a holistic way. Let's go around the pie chart, though, to lifestyle. This is where our OTs really come in to assess sleep, purposeful, meaningful activity. What is their pacing, energy? What is their diet and nutrition habits? What's their stress management like? All of those pieces that go into the person's lifestyle. I will say also we work with a physician who is lifestyle medicine board certified as well. And she will actually look at those pieces from a medical realm and how that might be contributing to a person's symptoms and medical condition as well. Okay, so that's the lifestyle. The darkest blue with the little brain is autonomic. You know, I'm an autonomic junkie. I just love the autonomic nervous system. So assessing it, so very important, particularly because some things that are helpful for one person are detrimental for the other person. So you really need to assess heart rate variability. We love using the LEAF. It's a portable EKG. It measures heart rate variability. Pupillometry and looking at the pupil response to light is a way to look into the autonomic nervous system. Looking at somebody's breathing patterns and their response to breath with movement. So again, to the question about how we might address functional tremor and dystonia, functional paralysis, things like that. We may look at how the movement changes when the breath pattern changes. I love doing just a simple extended exhale. If that helps, we will continue that into treatment. But I will tell you, some people, it makes things worse and we need to change. We might need to make breath work externally focused, for example, or in different positions, or not, that's not the focus at all. So really important to not take a one size fits all. That's why assessment is so very important. So those are some of the big pieces of autonomic. And then we can't forget physical impairments. I see this a lot in all clinicians, not just physical therapists. But sometimes when somebody has a functional neurologic disorder, you forget they can also have issues in the tissue. So nerve mobility, joint mobility, strength, flexibility, biomechanics also can be impacted and impaired and contributing to the overall picture. And so you want to assess those. I think one of the ones that I see most frequently missed is nerve dynamics. So doing some upper limb or lower limb tension tests. Heck, even doing, I just learned this maybe maybe 3 or 4 years ago, there's tension tests for the cranial nerves. Did you know that? Facial nerve, trigeminal nerve, you can also test those out. So I think that's really an important part of screening. Now, do you just run through all of the tests? No. Like, you would be here for days to do all of these, right? So where you start from the assessment is listening to the person. You'll hear me say that over and over again. I believe that my patients hold the keys in themselves. They have the answers there. And it's through careful questioning and listening that I'm able to hear that story and I start rearranging these pieces of the pie. We actually do this when we see people who are coming for our program. They do a free consult with us. Oftentimes online, but when we're listening to the story, I am actually creating this pie chart and I share it with the person. I say, from what you're telling me, this is what I think. You know, for example, I think there's a large sensory piece of this pie, or there's a large autonomic piece, or I'll actually make them all, different sizes. In this picture, they're all the same size, but I don't think I've ever met anybody where they're all totally equal. It's usually that somebody has a little bit here and a little bit there, and a large piece here. That is the secret sauce of simplifying your approach in functional neurologic disorders, is getting down to the underlying issues so that you're not just throwing all the techniques and all the assessments at a person, but then based on their story and careful listening, you can take that and then assess those biggest pieces of the pie first, see if you were right by listening to the story, and then you can take that into treatment. So I will do a separate live on our treatment pie, and I will remind you all here too that I am myself and Brittany Kim, my colleague, are doing a whole workshop on functional neurologic disorders, and it is next week. It is next Tuesday, in fact. In this workshop, we are going to talk about the strategies that we use and break it down pretty simply into what we think are the 3 most effective strategies that therapists can use to help make an impact in FND. This is the first time we're doing this workshop along with FND awareness. We have a huge goal to reach 1,000 therapists. We're inching our way actually to 600 people signed up for this workshop, which I'm super excited about, but I would love for you to share this. This is for physical therapists, occupational therapists, speech therapists, psychologists, recreation therapists, personal trainers, yoga therapists, people that may be interacting with folks with FND, because my passion is that all clinicians will understand FND so that all people with FND would have easy access to someone that understands them. This is the biggest piece that I hear from patients, is not being understood, or even worse, misunderstood, and is really detrimental for people. So I'm on a mission. Please share about our workshop. It's completely free. It's for clinicians. You can sign up at reactiveeducation.com, and you could put in FND Workshop 2023 and sign up there. It's next Tuesday live. I know it'll be on Zoom, and we'll send out a recording as well. So keep the questions coming, by the way. I've gotten so many great questions. Send me questions, respond here, put it in a comment, send me a direct message. Would love to hear from you. And I will keep sharing. I'll keep sharing what we're learning and what we're doing, what we're reading, and keep advocating for understanding of FND. So thanks so much for joining me today, and I will see you soon.